Now we have a representative for the Secretariat, Solveig Jónsdóttir, which is our CEO, and Margaret, which is the Secretariat. So they will be helping in this meeting. So, first of all, I will welcome all the foreign guests from the working group. This is a meeting organized by the Icelandic Medical Association on a matter of which the World Medical Association is dealing with just now. This topic is, you can say, twofold. It is on one hand health databases and biobanks, but they are very much related, as you can hear. There are two reasons for us to work on this just at this time. One is that WMA adopted a policy document on health databases in 2002 in Washington, D.C. And it was the view of the constituent members of WMA that this policy document needed a major revision. So that process has started. The other reason is that we have just ended, or WMA has just ended the major revision of the Helsinki Declaration, our major document that I think everyone here is aware of. I can just tell you that it has been translated in the Icelandic language and was presented in our medical journal just this week. I know that it's no surprise for the foreign visitors that we have snow in Iceland in March. But nevertheless, it has been a very strange winter. We have had hardly any snow or rain after Christmas, which is very unusual, but then just 2 days ago it started to snow and it will continue for some days. So please take that into consideration if you are going to any trips using this occasion to make some excursions. So I will just have a very brief history which is coming to what we are going to display. The issue of health databases inside the WMA started actually here in the spring of 1998 with ideas of a big centralized health database in Iceland. I will not go into that story, but one of the main pillars of that database was a genealogical database that had been collected for some time. For many years, actually centuries, it has been a hobby of many Icelanders to collect information of their families, and from not only from the core families, but also distant families. So we have many books and written documents on such things. Then a very energetic computer engineer started to collect all this material into a database, which was then bought by the Decode Genetics. And they had a lot of people going into the old files and complete this document. After a while, it was given by the company to the population. So it's a free access for everyone that is of this origin to have access to this database. And I will just show you some examples, actually 3 examples. I, as an individual, am able to go into the database and look at the information related to myself and how I am related to others. I'm not able to go in and look at how other 2 people are related. So I only have to go from myself. Yes, and then you have so I will just show you how we go about that, and I can pick anyone that I know of that I can see how it's related. In this database we have currently, I think, around 820,000 names. I might be wrong, but it's more than 800,000. The population is 320,000. So these are individuals that have been living in the country for the last 1,000 years. This country had the first general census of a whole population in the year 1703. And since then we had several censuses, of course. And so we have quite a good knowledge of the population 300 years back. So, yes, I will start by the President of Iceland. See how we are related. And she knows his name. So, yes, he's the top fellow. And then you can see how we are related. And this is very usual. It is 7, 8, 9, up to 10 generations. We are really inbred. So you can see that our common ancestors are this couple living in the 17th century. Now to another, you could say a sensitive matter, my wife. So you see how we are related. Quite many with that name for the last, no, not Bernard. So you can see that is a little bit, let me see, 6 and 7 generations back. And the third example is someone I have not looked at before. Just, I have no clue, and that is Solveig. And she has given permission to. All this material you have here on display are actually something you can look up in official records. It's no secrets. So, see. No. So you can see we have common ancestors in the early 17th century. This is of course for fun, and when it came out and everyone had access, then there were some secrets revealed. Some individuals that didn't know that they had a father that was not the one they had thought of, and so forth. But the reason for this to be in the population was that at that time it was known that the register was very correct, because when you compare the genetic research to the genealogical, you knew that the error was very low. It is among the lowest we have in the world. And the reason for that is that it has not been that difficult, quite often difficult, but not that difficult for a lady with a pregnant to reveal what is the father. In the Catholic countries, this error is quite often much higher. It's less than 1% here, around 0.5%, I think. Some of you might know better. But in Catholic countries, it might be 8 to 10%, which is quite high. So they would never be able to do this. This has then been a basis for the genetic research that has come out from this country, where you can actually relate individuals to each another, and you can actually tell, or you can decide beforehand what will constitute a family, for example. And very often it is in 5 meioses that constitute a family and so forth. So you can have a family on one hand and non-family members on the other hand. So this is the basis of a lot of the research that we have conducted here. So much for that. And now I think we will move to the agenda.